opioid epidemic is devastating to Virginians. In 2021, it cost Virginians more than $5 billion. In 2023 alone, 373 people died from drug overdose here in our area. And earlier in the newscast, we told you about the huge drug seizure in Lynchburg that included a large quantity of fentanyl that was confiscated. And we've all heard that fentanyl is highly addictive and deadly. But why is there such a high risk for addiction and dependence? And to shed some light on that, Dr. Robert Trestman, who is the chairman of Psychiatry and Behavioral Medicine for Carilion Clinic, is joining us with more insight. Thank you so much for being here today.
Thank you.
We appreciate it. So, in talking about fentanyl, why is it so addictive and so lethal?
Fentanyl is a class of drug included in the opioids, so it's like morphine or street drug heroin, but it was developed synthetically as a powerful pain medication. It's really effective, but it's over 100 times more potent, gram by gram, than is morphine. So a small pill literally packs a huge punch. And the punch I'm talking about is in part due to its impact on the brain. It releases dopamine, and we feel really good very quickly, in addition to all of the control of pain. So it can be a very effective tool for managing severe pain, such as might occur with someone dealing with different forms of cancer and bone pain. Unfortunately, it is very addictive, and we've come to learn its really dramatic impact.
Right, and you were saying it does have legitimate uses. That's important. It's not only on the street that we see this, but it's also in medical settings.
Right, and so medically we will use it for different range of inpatient purposes, but also it does come in a patch form that people can use who are living with chronic pain, such as with chronic cancer pain. So they're genuine and appropriate medical uses that allow people to function who otherwise might not be able to.
Sure, and we know that people get fentanyl on the streets, and just a tiny bit can be lethal and a tiny bit can be addictive, and often people don't know that they're taking fentanyl.
This is one of the real problems that's made it even worse than the now old heroin problem, because what's happening is it doesn't take much, and it's a white powder. It can be mixed in with other things. When people are buying different drugs on the street, for example, people are taking what they think would be an ADHD medication like Adderall. They think that it's going to help them on an exam, for whatever purpose. But what they may be getting is a pill that's laced with fentanyl. There's literally no way to tell these days what you're buying on the streets. And so it's incredibly dangerous. It can come in all sorts of forms. It can be dissolved, and marijuana leaves can be soaked in it. So when you think you're just smoking marijuana, you can actually be inhaling fentanyl. And a tiny dose can be overwhelming, because what it does, in addition to everything else, like reducing pain, it reduces the respiratory drive. That's what kills people. People stop breathing.
Wow, and just a tiny amount can kill someone.
A tiny amount can kill people, and we talk about fentanyl, but it's not just the one chemical. There are now over 1,500 chemical variants of fentanyl. And some of those are even another order of magnitude more powerful than fentanyl. For example, we see on the streets carfentanil, which is a tranquilizer that can be used for elephants. And
wow.
We have seen problems so that even at crime scenes, the dogs who are sniffing it can die from an overdose.
Oh my goodness.
So we're talking drugs that are easy to manufacture, are inexpensive to manufacture, and are flooding our streets, as the drug arrest occurred earlier today demonstrated.
Sure, and we were talking earlier about Narcan, about a drug that people can do for overdose, to reverse overdose deaths. And very quickly, if someone is struggling with addiction, what should they do?
Anyone struggling with addictions should seek help. Even just calling 988 getting access to care, coming to the emergency room if you're worried about an overdose, even just to seek care. Here in Roanoke, the Hope Initiative, based at the Bradley Free Clinic, has done a phenomenal job of connecting people with care. Any place you go to seek help is critical, but the first step is acknowledging that you need help and calling for it. Any of us at any facility will do everything we can for you.
Perfect. Thank you so much for your expertise. We'll have more resources online at WSLS.com.